Hello, hi Barakat. Just gonna wait for Elysee to join. Hi Elysee, can you join? Trying to. Okay, yep.
Hi. Hi.
What's up?
Good, good. How are you?
I'm good, man. I've never used live before, so I think
Mm.
it's um exercise.
Oh, no, of course. Can you hear me actually?
Yeah, actually, yeah. It's pretty.
Okay.
Are you in a quiet place?
What?
You're in a
I'm
good.
in a very, I'm in a quiet place.
That's good.
So,
That's good. That's the.
mhm.
I've been worried about something that this sound that was coming from next door, but I think it looks like it's better now. Um,
Okay.
but yeah, that's awesome, man. Yeah, so looks like we have Barakat joined. But also, yeah, this I will record it, so whoever listens later, could
Mm.
could learn whatever we talked about from today. Uh,
No worries.
yeah. Um, yeah. Before we get into it, I'll just do like since it's the first episode for this channel, I do want to I'll try to say something for those who are listening. I mean, for those who know me, thank you so much for supporting. Oh, hi, Aman. Yeah, for those who know me, thanks so much for supporting. One of the things I really am passionate about, right? Um, I'm currently doing finishing up my master's studying public health, and one of the things I love to do is talk about health communication, and I'm involved in research mostly, and I try to work on things and how to talk to diverse audience and try to make it more digestible and try to understand, and also love to talk to people's stories, and yeah. So Elysee, you're one of my my good friends. Really appreciate for being the guinea pig for this show.
No
Uh,
worries.
yeah. And so it's, I hope people can learn something out of it. It's titled Immigration and Health, right? Uh,
Mhm.
I want it to be as casual as possible because I'm someone who loves to listen to podcasts and YouTube videos. Sometimes like it's rigid, right?
Yeah.
And I do want to apologize. I just want to say something. I want to apologize for. I wonder if there's like a way to have like a uh, some sort of subtitle or to
Mhm.
I want to broadcast it in different languages, and I have people like from all over the world. Amharic
Yeah.
speakers. We probably like Swahili speakers. even French,
Yeah.
right? I don't know. It would be nice if you can do like multiple languages. But I'll try my best. I'll try my best to be more inclusive. Um, but yeah, Elysee,
Mm,
yeah, we can definitely get started.
mhm.
It's so nice to have you. And we've been to the same undergrad in Spokane, Washington, right? And you can start maybe with like, like a brief, intro. I'll try to make it as casual as possible, but I'll try to
Yeah.
think of topics that we might touch on. Okay.
Yeah. Intro. As Brooke said, my name is Elysee Kazadi. I was born in Congo and then raised a little bit in Kenya, and then immigrated here in the States. Did my undergrad at Whitworth. We were among the few 15 other black folks in the
Oh,
school. I did my undergrad in political science and like more of an international relations emphasis. And then now I'm finishing up my master's too in administrative and nonprofit leadership.
mm,
It's actually more like a public policy program, but specific. So that's what I'm doing now. And work-wise, I work at the Spokane Community College. I'm a retention specialist. In late terms, I help students stay in school. So we brainstorm things. We try and figure out how can I help them stay, is finding scholarships or helping them find school resources among many more things to just help students stay.
yep.
Mhm.
Yeah. Yeah. No, that's very interesting. I mean, I've tried my best. I mean, my master's program have that it's been very very hectic. I try to keep
Mhm.
up with where people are. I've followed you. I think LinkedIn has been very helpful to try to see those updates, especially learning because you've been updating. I think you're somewhat active there too. So you mentioned that you after graduating the retention specialist. So that's something. Do you work with a specific group? Is it mostly like just like university wide, or how is it like?
So the Spokane Community College has it's called a Center for Inclusion and Diversity.
Mm.
It's kind of like the building ISC.
Oh yeah, okay. So
Yeah.
yeah, for those people who
Yeah.
don't know, ISC is it's the abbreviation that our undergrad used. It's called, I think it's student cultural. No,
In
intercultural student.
student center.
Yeah,
Yeah.
yeah. Okay.
Yeah. So I work for the for that specific student success division, but the department is the multicultural student services. I serve the whole school, but I'm housed with the MSS. And so, what's the catch here is that so when students come in and walk in the multicultural student services, so I kind of have access to their grades and I track like their progress and we see how can we stop barriers for the students, mostly low income students, students from underserved communities, minorities, and so there's a whole range of students back there at the Spokane Community College, and it's big. Community colleges are big, so we have former refugee students, we have students from the islands like
Mm,
Marshallese students, we have students who are in their 50s and 60s trying to come back
yeah,
and really find a new calling in their life. So it's a range. And so when the students come to that center, I will help them out. But also I serve in like the school committees that check on retention and
yeah.
stuff for students.
No, no, that sounds very interesting, man. I don't know if you know this, but my senior capstone, I think, was actually on first generation retention research.
Mm,
So it was more of like I'm not sure entire. I don't know how we ended up
mm,
there wasn't like a specific program that was okay. No, there was bug spray. So we had this
mm,
within the center that we mentioned earlier. So there are they kind of like helped people that were first generation um, from like different backgrounds. So they're trying to make sure they're acclimated to that right, the university, but also trying to understand how life works. Right, it's very weird because from college, it's very like I mean, unless you have family, even for people that come from a different country to the U.S., right? Um,
yeah,
the it's hard to like really navigate around how do I, what's next, right? How do I get an internship, how do I get a job, right? So, uh, what you're doing is definitely like a very important role. Yeah, and also like you, I know some you're very active, even outside of school, right? And you've been in the past, you've been working with IRC, for example, World Relief, right? Is that more like a volunteer aspect? And also you updated. I remember you talking about the Washington State advisory Refugee Advisory Council, right? Can you like talk a little bit about those?
oh, yeah, I'm pretty active. So, like, I did AmeriCorps, and so the AmeriCorps I did serve at World Relief, and I served at the community college actually, and then my last AmeriCorps term I served at IRC. And so,
Mm,
for people who don't know America is like Peace Corps where volunteers go serve overseas, but America is more local here. And so I love volunteering, and so America was the perfect deal for me. And also, I'm a member of the Red Cross, like,
yeah,
too. And now we train. I train international humanitarian law, just to sensitize people about
yeah.
that. And then the Washington State Refugee Advisory Council I represent this side of Washington State,
Mm,
like Spokane and Eastern
mm,
Washington. So there's two of us. It's me and another fellow, Shafiq from Afghanistan. He was from an Afghani person. And so the goal for that council is just we sit with the state called the DSHS,
mm.
here, Department of Health and Social
Yeah,
D
yeah,
DSHS,
yeah,
yes, service,
yeah.
health and social service. And so we have sittings. We go through like various changes of like immigration that are happening. So we listen and we come with like what are some challenges we hear around, and then like you said, we are an advisory council. So we work with the state to see what elements and things we can help, like if it's disseminating information, if, for example, the new changes of immigration, we had a meeting in a public
Mm,
forum. We invited someone we have also people from the AG, Attorney General's office, to kind of help along those lines. So it's mostly refugees, people, asylum seekers, parolees, and kind of digest what will happen with all those statuses. And then community partners like here in Spokane, we have the Spokane Health
yeah,
Department. Same as with the states and with the other partners from like Kenwick, all those places. We
yeah.
kind of hear like recently there was an outbreak of, was it
Some
whooping cough?
measles, the empire. Yeah,
So
yeah,
there was measles, yes, but also before, like in February, there was, I think, was whooping cough.
yeah,
It was affecting kids and whatnot. So the council had the information, and then we kind of had the information and try and sensitize people also about it. So it's more advisory
yeah.
council. we can't do much, but we send those things. We work with the state, and the state hears the things. We send recommendations.
Yeah, no, Elise, I think what you're saying is it's one of the most crucial like components of what we like public health people would say, and that's we don't really rely on the like the medical professionals. So of course, we have
Mhm.
people that do the surveillance. There are people that
Mhm.
do the doctors that will treat the people that have might have had an exposure to
Yeah.
whooping. So whooping cough is pertussis, right? Um, and so the key thing is like what you were saying. It's that it's those people that are within the community, right? So we want people that are representatives from like the different counties, and also it's like it's really like a coordinated effort, right? What you're doing, it's an awesome thing. Like it's I wish I had. I'm really inspired by it. Really. Um, and one of the things that I was trying to like get on today was, with given your like your experience when it
Mhm.
comes to especially okay. One thing is you're familiar more with the Washington State, right? So
Mhm.
how does it work like internationally? So how do people get resettled if you have like an idea, but also like um how do you kind of coordinate, or and not just you personally, but how is it
Yes.
coordinated so that people have access to like the different
Um,
care and the system, like right?
so I'll take us to a class, a Refugee 101 class. So, so one is so there's a let's say there's an outbreak of violence in whatever
Yeah.
region it is, Africa, the Eastern Europe,
Mm.
and now maybe even susceptibly America. So once you seek asylum, you're under the UNHCR, and they signed a convention a long time ago
Mm.
in Geneva, the Geneva Convention, to kind of help with refugees and the people affected by violence all over the world. And so after that, you are an asylum seeker, and then depending on where you are, there's a country that hosts you as a refugee. So, for example, I was hosted by Kenya, and
Oh,
so
yeah. Okay.
in,
You're with-
in Kenya, so Kenya is where you get your refugee status. And
okay.
then
You see.
after getting your refugee status, you're resettled. You can go for resettlement. There are three options: go for resettlement, or you integrate with the society there,
Mm.
or you self-repatriate, so
Oh.
repatriation. If your country is safe, you can go back, and the UN helps you repatriate and go to back to the country origin. Or if you want to integrate and fully integrate with the host country, you can. And then the last is you being resettled in a third country. And so the country, you have no choice of the country that you
Yeah.
can suggest, but they just randomly say, okay, this is a country that we've seen that can host you depending on the situations and the things you've described. And most people just want peace and settlement,
Mm.
and so get resettled to a third country. And so uh, last the numbers are changing at the
Mm.
moment, but we speak there was almost like 120 million refugees all over the world, and then only 1% of that number gets resettled.
Wow. That's yeah.
And it's not many people make it also to get resettled. And then initially the US took almost like 100,000
Mm.
refugees to resettle. It's by the act of Congress and whatnot. And so,
Every year.
uh, yeah, at the time I was coming, I came during the first Trump administration. He had cut the number to 15,000.
15. Wow.
So
Mm.
I don't know. by sheer miracle and grace of God, I was among the
Yeah.
few people in that number. And then now that he's the second administration, it's called the US RAP, the US Refugee Admission Program.
Right.
He has
Yeah.
cut it, so there are no longer refugees being resettled in the states. And so you can imagine now, out of the 1% of the 1% of the
Yeah.
120 million, again, 1% of the 1% get resettled. And it's not like people always want to be refugees so that they get resettled. No one wants to be
Yeah.
in that situation. People always want to grow up in their country. Like me and you, we
Yeah.
don't have the joy of doing the things we're doing now in our own countries.
Mm.
Like imagine, like would be great for us, but
Yeah.
circumstances happened.
Yeah. Yeah. You're right. I think it's, I mean, different things leads you to your country of destination, I think. Um, and, it might be like seeking like quality education, or, and like you mentioned, it could be like very, very extreme, like war, and very, long standing instability issues, right? So it's not always, and you're right. I think it's people even after they've moved out of their, I guess their home country or where they've lived for, they still feel like they have that, you know, connection, right? That's why you see people still, although they're trying to assimilate into a new culture, they want to show that, they still want to like hold on to that. And you see that with like different generations as well, right? It's kind of like,
Yeah.
um, there you see the difference, right? So some are more connected to their, identity, and we see that a lot of that issues in colleges as well. But yeah,
Yeah.
very interesting. I mean, there's a lot of, I mean, in the media, you see like some countries more than others for sure, but there
Yeah.
are, like you said, like hundreds and millions of people that are in a very tough situation. And what, like personally, like as someone who's more in the medical side of the, like sector, the first thing I instantly like I think of is when something happens, right? So let's say like a
Mhm.
war breaks out.
Yeah.
I don't know why, but I mean, people like I might have people who are gonna watch this video
Mhm.
in my field or
Mhm.
in my master's program. The first thing that we think of or we talk about is, oh no, there might be like a polio outbreak, or
Mhm.
oh no, the health system is about to like get ruined. That we're gonna see
Mhm.
people like actually die. You can actually make the connection. Uh,
Yeah.
and yeah, it's very insane. But of course, it's a lot more complex than that, right?
It
Um,
is.
yeah,
It is complex, and there's mechanisms that how, like, that's where now the role of NGOs and non-profits and whatnot come and help. Can you imagine there's the pandemics of the health risks that happen? Remember,
yeah,
war doesn't stop babies from being born, doesn't stop germs from being spread.
mm,
Like every disease continues. Think of now let's say in Congo and let's say in Gaza or everywhere, there's people probably that have HIV.
mm,
Every HIV is going to still be spread. There's like normal, like en français on the la toux. What is la toux? Cold, yes.
yeah,
Normal cold
mhm,
that still is going on there. And so because war is happening, the health risks don't stop.
yeah,
So
yeah,
a baby has to be born, a mother is due next week, and there's war happening.
yeah.
What happens? And people don't see the ripple effects of
Oh, yeah,
chaos and whatnot. And I see that too, and I go, oh my goodness, another baby is about to be born in a dire situation. What if the baby needs
mm,
oxygen and the roads are blocked?
yeah,
And then I go into this deep hole.
mm. man, how many is it like every minute or something? There's like a
Yeah,
graph of how many kids not just being born, but even dying.
yeah,
Like it's like we don't really think of those things. One thing that I've recognized is even with myself is when when chaos is happening, you try to do distance yourself because you know it's okay if I don't watch the news all the time, if I don't if I don't listen to this debate or whatever, I it feels like it's
mhm,
you're actually more control of your life, or you're like more I guess calmer, right?
mhm,
Um, but yeah, it's interesting. I mean, it's good to be like more conscious about
mhm,
and also like I like that you mentioned NGOs and different stakeholders that really could play a huge role, right? And they
mhm,
are for
yeah,
sure. They've been doing that, right? Yeah,
mhm.
yeah,
It's 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 interesting. There's both good and a bad side. Of course, we know as human beings, nothing is 100% an absolute, oh, this is good and this
mhm.
is bad. Within the NGOs, there's some bad actors within them, but they're good actors too. The role itself of the NGO is to help, but also there's some trade-offs. For example, there's the Médecins Sans Frontières,
Yeah.
MSF,
MSF, yeah.
Doctors Without Borders. They are helping people.
Mm,
IRC, where they're helping people and do things. I was also like one of beneficiaries. There was a program like JRS. JRS is JRS, Jesuit Refugee Services. So we they gave us like insurance, like health insurance for people down there where we were, and they help us pay the health insurance there. Like they have, they call programs for livelihood. There's the Danish Refugee Services. There's so many organizations that actually do the work for to help mitigate these things because the whole world can like the countries themselves can't do this. We need many hands and friends to work through things. And so there's an importance on the role of the NGOs. But again, the bad actors, like bad people who kind of try use that to manipulate things and stuff, make it hard for the millions that actually benefit from the health benefits or the benefits in general that come from that.
yeah, yeah. No, that's a very interesting point, man. I mean, it's always tough, right? Because ultimately, one of the things that that following the like the federal cuts that are happening university, one of the things that
Mhm.
I've recognized is how even institutions that you think are very like well off, right? So
Yeah.
I go to Johns Hopkins, right? So Johns Hopkins gets billions. Like I mean, they were it's really like out there. There's like
Mhm.
funding. You think they could really afford to like help, to make a large impact. But as soon as the federal cuts were happened, there was
Mhm.
there was the whole institution, even the hospital was shaking because I think it lost around like 800 million
Mhm.
one in one round of like I don't know. There's like a series of cuts that were happening.
Mhm.
Right.
Yeah.
Yeah.
But
And it's just
you it you've mentioned something about John Hopkins. I remember I actually when I was in Kenya I trained as an EMT. We our scope was more higher there. Like we could do like IVs and pace and we could
okay.
give like injections and even chest tubes things and the
What?
so
Yeah.
Kenya started the EMT program in the 1999 I think maybe after the bomb blast that
Oh,
happened over there 98 something
okay.
and guess is who partnered and came to bring the program was the John Hopkins University teachers that came to teach the first ever EMTs in Kenya, and they started in like, can you imagine, like 2000, like in the year 2000, and by the time I was doing it, I was among 3,000 EMTs in the entire
Yeah,
country. Like,
yeah,
think about it. Now the program has grown, and this is Kenya. It's quite modern. Like
yeah,
now, so think about, people don't look at the impact that that has all over the world. Who knows what program maybe it was an oncology program that John Hopkins had with a nation
mm,
somewhere, and they were relying on that, and now it's gone, or because maybe leaders ran the government thinking it's a
yeah,
business, and yet the
yeah.
government is not a business entity. It's more, it's interesting. We only have one government or one country. We can't go and say the country is bankrupt and we need to open it.
It
It's
feels like
confusing. I'm like, I just go on a spiral on that. You mentioned John Hopkins, and I was remembering I benefited. Like I was the small seeds they planted. I know a few things of being an EMT now, and
yeah, that's
so
that's no, that's very awesome. Like it's one of those like very I mean it wasn't it is really intentional. I guess like you were saying the thing that I guess some programs and some initiatives have really worked. Um, in terms of when I say that, what I mean by that is the goal and whatever they do
mhm,
has to be like well, right? Um, and even I mean the government, even the issue with like some countries is
mhm,
even the government, right? So
yeah,
is it really accepting? I guess I mean corruption might be there as one example, but is it really?
mhm,
I mean, is it accepting that kind of? Is it supporting these programs? Are they sustainable for long term?
yeah,
Because the population is one of the fastest. Like Africa, the sub-Saharan Africa is one of the fastest growing regions in the world as well. And you want people that are really trained. And we're seeing that. And one of the things that really amazed me as I was doing my master's program was to see how really low resource settings kind of being created and how they train people. So instead of since training doctors is very expensive, right? For example, they would design programs to train, let's say, people who have a high school diploma into for those people to do like a few of the responsibilities that a doctor or a nurse would have had
yeah,
in a normal setting, right? And that's been very effective in a lot of places. And people that would have died, we would have had like a high statistic of deaths, and especially with like maternal
mhm,
maternal deaths, and like children dying, like little children under 5, under 1, and that has been kind of prevented. There's a long way to go, right? It's very like it's very intense.
that's
Um,
true. Yeah, what you mentioned is actually
yeah.
like or correct, and because like the EMT program I was telling you, we they had like little certifications, like you can do ACLS. ACLS is Advanced Cardiac Life Support,
Yeah.
and so I learned how to read the EKGs and
Well,
do the defibrillations and processes like cardio. Uh, Pericardiocentesis, where the
everything.
heart is lumped and you take out the fluid from the heart, like little interventions, because we don't have they didn't have the ambulances to get to the before the ambulance gets to the person and before they go to the hospital. That's 3 hours, bro. three
Wow.
hours, right? And then
You did that.
like
Yeah.
we maternal health, like they had programs, I think, with the EU, I remember, where in the remote towns and places where instead of an ambulance, people have bikes and like velo. Velo is what
Is,
bikes? Bicycles,
is
the
it
normal
like
bicycles.
is it just two wheels? For the, is it,
Mm-hmm. But it has a wagon,
oh,
you know,
the
yeah,
wagon. Okay.
and training midwives to
Mm,
handle kids and training them. Oh, when some baby is born, call the hospital, and the hospital will help you deal with this and stuff. They do help because not there's no equity actually. This was to
yeah,
help bridge the gap of equity
yeah,
and reduce barriers. That's what even like at my work, reducing barriers for students, and that's the role of all these things: reduce barriers for people,
yeah,
because people would have died for just small
yeah.
tiny
Very
things.
preventive, right?
Mhm.
Yeah, very preventive. It's I guess like the creativity is what really like inspires me. It makes me feel really optimistic. And I don't know what you think about more of the future aspects. I mean, in terms of like maybe digital like digital health, like we're seeing a lot of things being implemented. That's one of the things that's very fascinating. We're
Mhm.
seeing not just in health really, like in even other sectors. It's making things a lot easier for this lower in kind of country, lower income countries, right? um, it
Mhm.
might, I don't know if that's very related to people like moving out of the country, because that's what we're
It,
talking about.
it is.
Mm,
It is related, actually, the way we bring technology. I think there's something, they call it the digital divide,
mm,
just like that. So even sadly to say, even here in the States, there are places where they don't have access to the like internet,
yeah. Oh,
the infrastructure. And so the rural places, they also have a hard time, not just like even in Africa or Central America or other places. And so if governments, again, when we were learning simple things, invest on the infrastructure, and then so everything else kind of will follow, like, because we now need to have like kids know how to use a laptop or a phone, so that on event a doctor is not there or there's no access there, they can see something
mm,
on and prevent something from happening, or the doctors like oncologists can reach people in the remote areas, or people can now innovate better dialysis tools or thingies, because dialysis maybe costs a lot of money. Maybe there's new battery, like solar powered monitors to send to remote areas, so that they don't have to use the batteries to measure BP. There's a lot of potential
yeah,
we're talking about. Yeah.
yeah. It's interesting because one of the research that I've been doing is actually looking at conflict areas and how specifically how vaccines have been being delivered, being reached
Mhm.
people, and a lot of it has to do with like technology, um, a lot like creativity for the most part.
Yeah.
We've talked. It's very one thing that just came to mind is what do you think? I guess the U.S. is a lot it's very very ahead of so many countries, even though we're seeing its issue very magnified, right?
Mhm.
Because everyone pays attention to the U.S. I
Mhm.
wonder like ways that we can really address the issue, especially having to do with like resettlements and immigration,
Mhm.
refugees, and that kind of thing. Yeah, it's very something to think about.
It is something to think about, because also, like, with all this happening, maybe even leverage that to even, there's refugee camps
Mm,
everywhere. And so how do we solve like issues to help like test things, technology in the
mm,
refugee camps, or areas of those concentrations, so that on event they are resettling these people. Already they know from the onset that all the people that we are resettling, some are coming there was a program here in Spokane where they noticed that the refugees coming from Syria, Afghanistan, there's like I was in IRC where they did a good job. They
Yeah.
noticed the pressure cookers that they were cooking
Yeah.
with had
Really?
lead, and
Well,
the mascara they were putting on the had lead too. And so they did a port exchange kind of program. And so all the refugees that came with their pots, because for them it's prized
yeah.
possession. My grandmother gave me this,
Yeah.
but it has lead and it's gonna affect the kids and whatnot. And they did a pot exchange. They don't end up losing money by buying a new one, but creativity, how you were talking about, and it helps again the generation of kids that will be
Yeah.
coming, so they won't have health issues when they're growing up, and that's a less one more barrier that is skipped
Yeah.
because of like, oh, because of the change of lead pots, I'm able now to maybe
Mhm.
do other things. Like there's more and more barriers, but if we remove one and
Yeah.
one, who knows?
No, yeah, like you're right. I think it's just maybe divide and conquer. I don't know if that's the right, but you would. It's it's interesting because one of the one of the issues that may come from, let's say, the cooking practices of people is is that when you're asking them to switch out, because I remember specifically reading about, I think it was in Peru, where there was this researchers that were doing they were trying to like address air pollution, so like indoor air pollution. And these people, they were using an actual like wood fire in the house, because it's the same place where they're sleeping, and there's like kids. So like what they're saying, okay, let's introduce this electric stove or whatever. They tried to follow these people, and then what happened was they just immediately there's like, okay, the food doesn't taste the same anymore, even though it might be like a psychologically, but it's very, it's like you're challenging them, but also telling them that what you're doing could actually really make you really sick, right? Yeah, it's a hard balance. Yeah.
It's hard, and there's another layer there. If you go down into a rabbit hole, some people, maybe it's faith related and religion and culture related. And so, what are you going to do to bridge those like things and say, hey, yeah, this is your culture, but look at the ramifications of this. Maybe slowly introduce things to them and not tell them that, oh, you're losing your culture so that you become healthy. No, there's still practices of your culture and still
Mhm.
be healthy. For example, like circumcision, for example,
Yeah.
for those, back in the day, there's some communities that do that. The guys that go to a river very early in the
Very
morning,
like.
mud, and then the knife cut. But now people can still have the cultural thing, but in a hospital, or they send a doctor there.
Like, yeah.
They send a doctor there to help them with
Yeah.
the surgery, the procedure. So again, creativity, as you mentioned, there's so many things.
No, that's yeah, that's hard to challenge people. I mean, it's these kind of things. Yeah, I mean, of course, like, and if you're moving to a different country, there's part of you knows that it's gonna be different, right? And part of you want to like keep that, you know, um, what your ancestors did, or what your grandparents did,
Mhm.
the practice, because that's really that's really how you define your identity. Um, yeah, it's a good conversation, man. Elysee, so nice to. One of the things that one of the reasons why I reached out to you was that you were doing this monologue type of thing where you
Mhm.
talk about different issues, and I think it's kind of to, as you're wrapping up, I do want to like touch on I guess
Mm.
the state, right? It's
Mhm.
and first
Mhm.
first yeah, or yeah, it's a lot. It's a lot to
Yeah.
really discuss about because
Mhm.
what the topic that it's immigration and health today, and
Yeah.
it's very heated
Mhm.
issue. It would be nice to, I guess, a little bit like try to humanize it a little bit.
Mhm.
Try to You can start with, what do you do with your monologues, but no, it is a monologue, right? Because you talk what's
Well,
on your mind. You don't really have it scripted, which is so cool. And yeah, you can talk about that a little bit, and then that kind of like leaves us to this, open-ended question on what the future can be, right?
oh my goodness, no, even get me started. It's just that I see things and growing up in different settings, you grow up with, like, for example, I have not gone through as much turmoil as maybe some people, and but I've developed a form of like resiliency. I remember our parents when we were young, they were telling us, be nice to your neighbors, share things and whatnot, so that the society can be better and what. And so for us, those were the dreams that, oh, when I share this or when I do this, there will be peace because there was absence of peace at the time. And so now I'm growing up and I'm seeing people. I'm growing up. I'm almost 30. Oh my
Yeah,
gosh, damn.
yeah. Time flies, man.
And then I'm like, people are normalizing bad behavior. And there was one play monologue I said it's in Swahili proverb. It says "Mafi akali hayanuki." That's so vulgar, but it says poop from the past that doesn't smell
Just
and
okay. Well,
doesn't smell because fresh poop, even from let's say a dog or something, at the moment you will feel the stench,
mm,
but after some time it dries up.
yeah,
And just because it doesn't smell anymore, it doesn't mean it's something else. It's still shit.
yeah.
So
No, you're
so
so-
So I was like, what can I do now? Because I felt helpless. And I'm like, I'm not a millionaire or a billionaire. You know what? I'll say things. And then combining with faith and challenging myself because I'm like, I'm seeing this script. I'm from a Christian background. I feel like I've seen this movie before from the stories I've read in the Bible with these people that prosecuted Jesus, and then now are coming. It that was in Acts, and they're like, "Oh my God, did we just kill the Messiah?" And so the Messiah was right in front of them, and now here, this kind of like what's the parallel to that, where people were being told about policies that will harm them, and then they were like,
yeah,
and now it is harming them, and they're like, oh no, so then what shall we do?
yeah,
And then now what shall we do is I was like, we go back to this drawing board. It's about the community, the love. If I know my neighbor and I love my neighbor, no one will come and tell me, "Oh, your neighbor is bad," and what. No, it's kind of from a small thing and then goes up from the
yeah,
friendships like we have. Remember, we used to have time. We go and eat at, let's say, Ross
yeah.
place. All of us eat
Oh
some
yeah.
African food.
Oh man.
It's like that's a community. Like I was thinking, oh, and I'm like things the in Swahili they say haba na haba hujaza kibaba. Like slowly and slowly the bird will bid its
Yeah,
fall. And so I'm like, let's do something or let me express this. And so I was like, I won't keep quiet. I'll say things and then eventually also do things. And I was like, even if it's one person
mm,
that sees it, at least I start up the conversation and now try and do something. But it's interesting times because I'm like, we left our countries and things were not well. Then we come back we know how this thing works. They
Yeah,
behave. So I'm like, no, but it is what it is.
it is what it is. Like it's changed. Uh, and I can confidently say, I think my audience, it's very
Mhm,
diverse. So get to
mhm,
hear, you know, I would invite people to actually really talk. You know, it's that's something that
mhm,
I love to do. Is really
mhm,
like it try to make sense of things, and also like you were saying, we had this, you know, the dinner or like lunch or whatever that we get invited to when we were right. It's when you're in that moment, you forget everything, which is so cool. And then everything we have was like out of the window. Um,
mhm.
it's so nice to hear that again. And you know, if we can create those moments, people will at least like try to understand each other more. And I think, yeah, I think the world would be would be a more like, I guess,
Yeah,
yeah,
it's
nicer place.
it's rough. It's rough, but we also have our own biases and
Mm.
things. But the moment we sit down, we talk, and like for example, I know we have uh, differences. For example, this is silly, but you're a Man United fan.
Okay,
I
that's
am. I'm a Chelsea
oh,
fan, and we do not like.
nope. That's- I think if it was Liverpool, I would not be. I'm kidding.
You'll be incensed with
Okay.
everything. But we find times to talk through our differences, even religious or what. We do not agree absolutely on things, but we have common grounds that ground us together as human beings, and we agree in those values. Why not us work together the way we're working and try and build them up? I'm like, am I naive to think about that this
Yeah,
way?
like, give me perspective. Yeah, yeah. I mean,
So I'm like, I don't know.
no, that's true. Like sometimes you learn more when you try to say something to someone, and then maybe you want to understand like how that person received. Am I like phrasing it right? So you'll be like, am I saying this right, or am I you know? Oh, actually, and then sometimes you might get some clarity when someone else. Oh, okay, okay. I see how this might have been taken as. But yeah, it's oh, man, it's been really awesome to catch up with you as well. Like I don't think like a video. I we've
Yeah.
talked, but you know, and one thing that
Uh,
I'm trying to include in this, I guess, whatever is, I thought about it. So you're the first one. So no pressure. Okay, so it's Buna break, right? So the channel is called Buna. Buna means coffee in Amharic. And I thought
uh-huh,
about this question: if you can describe your life journey right
mhm.
now, not it, if you can describe in terms of a drink, like what would it be and why? You know,
My life journey in terms
like
of a
maybe like
drink.
right now is better because the life because it's I know it's tumultuous, like you know ups and downs. But right
Mm,
now, what do you
My
think?
life
Mm,
as a drink, it will be, oh, oh my.
I'll
It
give you some time. It's okay. We have like
will be, I think actually water
ooh,
for
ooh,
some reason.
okay.
You know why? Because sometimes we know water is good for you,
Mm,
but I don't drink it all the time. And sometimes water, I use it and put some and boil it. I put some tea
mm,
in it and I drink it. And then depending on the time, also this I don't know if you've seen the water like sparkling water.
mm,
You add some things and it becomes soda. So I think like sometimes I just have that ingredient water. It can turn out to be so many things depending on the
yeah.
time. So at the moment, I just added some few fruits, I think, and put it in the freezer.
Wow.
So I'm hoping it turns out to be a drink or something. But I think life for me now is just that agua.
Yeah.
I don't know.
No, that's wow. Like for everyone who's listening, I did not give him this question. I promise. Ahead of time. I mean, I like how you on the spot. I like how you man. That's very cool, man. Yeah, it's. But yeah, thanks for joining me, Elysee. And
No,
thanks for everyone. Um, and I hope
no,
get to have this conversation. Once
yeah,
again, I invite you back. But yeah,
yeah.
yeah, it's good to see you, man.
Good to see you. Take
Yeah,
care. Stay out of trouble.
yeah, for sure, man. You too. Yeah. Bye, everyone,
All right.
for joining.
Bye.